Hi, my name is Brittany, and I'm going to be discussing my field experience as a constant observer. Okay, so an overview of placement. What it looked like for me is I worked closely with my advisor, Chris Kays, to try and find a match for field experience, something that made sense for me and what I may or may not want to do in the future. I came into this experience very undecided, knowing that I am passionate about psychology and I want to do something with my degree. I just wasn't exactly sure what. So Chris helped me discover this field experience position as a constant observer at the Newburgh Providence Emergency Department. We ultimately decided that this was the best fit for me and something that could help me dive a little bit deeper into what psychology can look like in a medical and professional setting. Through that, I worked closely with Carol Jakewith to begin the onboarding process. I submitted my resume and was accepted for the position, and I did a medical training session with a couple other George Fox students over at the Newburgh Hospital, and I just got ready to start the position. So the responsibilities that came along with being a constant observer included constantly observing patients. So what that would look like is I would just have a monitor in front of me and I would be observing the patients the entirety of my shift. I was responsible for documenting every 15 minutes any activity that the patient had done, whether they were sleeping, resting, confused, or agitated, if they had eaten, if they had been administered any medication, and if they had left their room for any reason, such as using the restroom. It was also my responsibility to alert the medical staff at Providence ED if any emergency situations had arisen. Maybe the patient had been hurting themselves or was growing agitated. It would be my responsibility to alert staff so that the patient could be receiving help as soon as possible. And then it was also my job to notify the next constant observer, which would be another George Fox student, if they were needed for the next shift. And when shift change did occur, it was my responsibility to notify them of what was going on and what they could expect for their shift at the ED that day. Working as a constant observer, you're definitely exposed to some experiences that are a little bit alarming and can be unsettling at times. But I feel that this exposure has been so great for me as it has helped me and my passion for psychology to grow. I've also been able to grow and further develop skills that I think will help me in a professional psych setting, such as time management. As a constant observer, you're always on call. You're never actually promised the shifts that you're signed up for. So I feel that I've been able to develop my time management skills a little bit further. I'm also able to stay more calm and collected under pressure. You're definitely in situations as a constant observer that you have to act quickly and you need to remain calm for these situations while alerting staff of an emergency. I'm also finding it easier to recognize symptoms and feelings of patients, which I think will be helpful in a future maybe counseling career or something relating to the emotions of others. Going into this experience, I definitely set some goals for myself. The number one goal being that I wanted to witness mental health emergencies and gain a better understanding on what necessary assistance is provided by medical staff. I just wanted to get a better understanding of what it looks like in a professional setting to help mental health crisis patients. I also wanted to be able to apply previous knowledge to new experiences, meaning knowledge that I had acquired from previous courses. I wanted to be able to apply that to these experiences. I also wanted to develop/grow my skills such as time management and communication. And I feel like I was able to do both in this situation. So during my time at Fox, I've had the opportunity to take some amazing classes, but there are definitely a few classes that stand out to me when I'm asked the question if there are any concepts that I learned from prior courses that actually I find relate to my experience. Um, I would have to say the one at the top of my list is abnormal psychology. In abnormal psych, we learn about different mental health disorders and the etiology of these disorders, and symptoms to look for, how to treat them, etc., etc. So I feel like this course has definitely exposed me to the many, many, many um, disorders that exist, and what drug addiction can look like in patients, what depression can look like, and how it just can differ from person to person. And then the other courses that I find that are so helpful, and that I constantly am pulling concepts and applying them to every shift that I have, is counseling and advanced counseling. And in those courses, we learned, patience for others, compassion for others. But we also, I think the thing that sticks with me the most is how to recognize and label feelings. And this is something that we practice with ourselves, but I find it to be also extremely helpful working in the emergency department, how to recognize how somebody else is feeling and when it's appropriate and not appropriate to alert medical staff of maybe they're becoming more agitated, or I'm able to recognize that they're starting to calm down. So I'm so thankful for these courses specifically, but I know that there are, of course, other courses that I could say apply to this field experience. I've been able to notice and recognize the influence of my faith as a constant observer, as it definitely, I feel, being a Christian, it helps shape the way that I view those who are in need. I'm constantly reminded that I am in a community with these people, and that nobody wants to be in a position if they can help it, such as these people are. And so I often find that I'm silently praying over these patients when, things sort of settle down and we're given a quiet space. And I know that as a Christian, God has provided me with a lot of compassion and empathy, and I feel that that is one of my greatest gifts from God. And so I'm really grateful for the opportunity, to be put in a position where I am able to do even if it's a little, I'm able to apply my empathy and compassion for others, and help where I am needed. Um, I also know that my faith has led me to this career path. I've always felt pulled towards having a professional helping career. I was never entirely sure of what that looked like for me, and I'm just really thankful to be given this opportunity, which I will touch on later, to dive deeper into what psychology can look like in a professional setting. And I just definitely, I know that this is a path that I am called to. Okay, that leads me to the question of whether or not I have intentions to continue a career or have a future in the field of psychology. The answer is yes. I am so passionate about this field. I think that we are so blessed to be living in a time that we know so much and are learning so much about the field of psychology. Um, I know beginning my educational career, I felt very uncertain as to where I would wind up as far as career wise, but I feel that this experience has really helped to solidify my feelings and thoughts about whether or not a psych profession would be best fit for me. And then another question is how ongoing career planning has been influenced by this experience. So I have really developed a soft spot for people who suffer from addiction, and I've noticed it's such a large problem in the community. And I feel that I'm being called towards counseling at this time. So I think that I am inclined to most likely attend more schooling, probably get a master's degree in counseling and eventually having a career in counseling. So, in conclusion of my field experience, I find myself just repeating the same three words over to myself. I am thankful, I am grateful, and I am blessed. I'm so thankful to have such amazing people to look up to for guidance, such as my advisor, Chris Case and Carol Jakewith. I am so grateful to be given the opportunity to be a student at George Fox, where we're given opportunities such as field work to gain experience in our field of choice. And I am so blessed that this is where I wound up. I'm so blessed that I was, provided with an opportunity to work with people in mental health crisis and see how important this field is.